Great. Next we have Rocky Thompson, who's the Policy Director for the Louisiana Department of Health and Hospitals. Rocky's worked not only in North Carolina, but also in Louisiana in the North Carolina Medicaid program, and previously worked in the Louisiana Center for Healthcare Innovation. Rocky?
Sure. Good morning. Thanks for having me. Governor Jindal of Louisiana, at the beginning of his administration, we had a Medicaid program that was failing Louisiana residents, both enrollees and the taxpayers. As a safety net for children and pregnant women from low-income families and individuals with disabilities, the administration immediately went to work to reform the state's $7 billion Medicaid program. Now, Medicaid is a tremendous driver in the healthcare market in Louisiana. It covers 1.2 million individuals and pays for more than 70% of all births in the state. I think I heard earlier Oklahoma pays for a little over 60%. We took Medicaid reform seriously, knowing the impact this plan that would be developed would have on the lives of individuals in our state. Louisiana has ranked near the bottom in healthcare indicators and outcomes. A successful Medicaid reform would impact Louisiana's lagging health outcomes. Now, Louisiana was lucky because it was one of the last states to implement Medicaid managed care. So we were able to take lessons and best practices from dozens of states, including Georgia, including Florida, and we were able to transform our healthcare delivery system with the introduction of two major Medicaid managed care programs, Bayou Health and Louisiana Behavioral Health Partnership. Now, Louisiana's managed care program continues to evolve. We are currently developing a managed care program for our Medicaid beneficiaries and long-term supports and services, and we're currently working on reprocurement of our Bayou Health and our Louisiana Behavioral Health Partnership. Now, the state's Bayou Health program is entering its third year of operations. It manages the care of nearly 900,000 enrollees that were transitioned from legacy fee-for-service to a managed care program of their choice. Our Bayou Health program consists of 5 plans managing the care of the majority of our state's Medicaid population. 3 of these plans are prepaid or capitated, and 2 of these plans are primary care, case management, or shared savings programs. Now, all of our plans operate statewide, even though they were phased in by region. When announced, our Bayou Health program was met with strong resistance from many stakeholder groups across the state. It was a process that took years, but we were able, during the implementation of Bayou Health, to employ war room readiness at launch, including daily open provider calls, regular email communications, and 24-hour guaranteed response time to email inquiries. We have also regularly posted all information on our website in an effort to be as transparent as possible. Gradually, by working with our stakeholders, involving them in the development of this program, support for it was broadened. We learned that it's important to enlist partners to sell their story and to recruit champions from the community. Through Bayou Health, recipients have access to new resources to promote the greater coordination of care and the management of chronic disease. There have also been significant improvements in the quality of care delivered. Bayou Health plans are investing in an infrastructure of care coordination to help individuals get necessary preventative care and to stay healthier. Louisiana's experience has found that access to providers and the quality of providers delivering these services have increased through managed care in the Bayou Health program. During the first full year of operation, more than 25,000 individuals received case management to help them manage their chronic or high-risk conditions. Health plans help more than 63,000 of their members to quit smoking, lose weight, and to gain access to dental and vision services. The average length of an adult inpatient hospital stay has decreased across the board from more than 4 days under legacy Medicaid to less than 3 under Bayou Health, which represents far fewer hours away from the home in expensive hospital rooms. Claims data reveals a significant reduction in statewide NICU days paid for by Medicaid, meaning more babies are being carried for full term. This means healthier babies and a huge savings for the state, because you have to realize that the cost for premature infants in Louisiana is $33,000 compared to a national average of $4,000 for term newborns. Now, quality has been very important in designing this program, and it's a must. We continue to be engaged with our partners, having regular meetings with leadership and in-depth business reviews quarterly. A recent federally required independent review of the 5 Bayou Health plans say that they meet 98% full and substantial health plan compliance across more than 4,000 collective state and federal regulations. The quality of our Bayou Health plans are first rate, meeting quality guidelines set up by the state and the federal government. Now, our state's second major Medicaid reform, the Louisiana Behavioral Health Partnership, operated by Magellan Health Services, was launched in March of 2012, so right after we started Bayou Health. Prior to the partnership, behavioral health programs were spread out amongst 4 different state agencies. Poor coordination between these agencies and a lack of community-based services and family support mechanisms meant that these children were often placed in facilities far from their families and their homes. One aspect of this partnership created a coordinated system of care that serves as a single entry point for services for children. Instead of navigating 4 state agencies to access disjointed and duplicative services, families with eligible children can know where these services, how to access these services through a single entry point. Non-Medicaid eligible children and adults can also access services through state-funded behavioral health clinics and our residential services, but the service array is the same. Since the launch of this partnership, we have seen major improvements across the state in how behavioral health care is accessed and delivered. We've seen 3 major areas of success since the implementation of the partnership. More people are accessing behavioral health services. Approximately 85,000 and 191,000 people with serious mental illness, major mental disorders, acute stabilization needs, and addictive disorders have been treated under the partnership. This exceeds the program objective of treating at least 50,000 children and also displays great progress in how many adults we have served. People are receiving a greater level of care that is less restrictive and more matched to their needs. People aren't just being sent to beds anymore. By enhancing access and offering coordinated care management, the partnership is expected to yield a reduction in unnecessary hospitalizations, institutionalizations, and emergency department visits, and a higher quality of care for children, adults, and their families. We have already seen an increase in the use of outpatient behavioral health services by children, and a decrease in the amount of time people across all levels of care and in all populations are spending in restrictive placements. In addition, fewer people are readmitting into high levels of care. And people have more provider options than ever before. Prior to implementation of the partnership, there was only a limited array of Medicaid allowable mental health services for children, and none for addictive disorders. There were significant gaps in the behavioral health system in Louisiana prior to the partnership. We have made significant improvements and continue to focus on the expected delivery and necessary adjustments that our system needs. The provider network has grown from 800 providers to over 1,700 providers who provide a total of almost 5,000 specialties of services. After implementation of the partnership, we have created a vast new service array in both mental health and addictive disorders under Medicaid for enhanced federal financial participation and dramatic expansion in the provider network. Now, I know you're all asking, this is great stuff, but what about the money? The budget impact. The implementation of Bayou Health and the Louisiana Behavioral Health Partnership has not only led to increases and improvements in health outcomes and in services, but also to increased budget predictability. The state has already realized a cost savings over what the state would have spent in the absence of managed care. I think in the first year is about $120 million. While Louisiana Medicaid expenditures continue to grow, the growth rate has stabilized over the past several years, and the growth rate is much less than national expenditures. This year has grown 2.6% over the fiscal year of 2013. In fiscal year 2015, expenditures are anticipated to grow 4.5%. Now, nationally, Medicaid and CHIP expenditures are anticipated to increase 11.9% this year and 8.5% in 2015. Now, our work is not over yet in Louisiana. We're working on the next phase of our state's Medicaid reform. While initially carved out of our managed care programs, we plan on launching a managed long-term supports and services program next year, taking into account the lessons learned so far from our previous Medicaid reforms. We feel that this population, individuals with developmental disabilities and adult onset and aging-related disabilities, will benefit greatly from managed care through the coordination of care and increased services that we can not offer in today's fee-for-service program. This is also the most costly segment of our Medicaid population, and managed care has proven in our state to bend the cost curve, stabilize costs, and offer budget predictability. This effort is being developed by the state with significant input from stakeholders. We requested an RFI in November of 2012 asking for creative, innovative, and viable strategies that will assist Louisiana with restructuring the organization and delivery of Medicaid services for this population. We received 18 responses, and in August of 2013, we issued an initial concept paper for the transformation of managed long-term supports and services in Louisiana. Since the initial concept paper was released, the Department of Health and Hospitals has begun a robust effort of involving stakeholders across the state. In October 2013, we convened an advisory group of stakeholders to discuss basic program design. This group is made up of a diverse group of stakeholders, representing providers, families, and advocates, and it's very important to get these people involved very early on the front end before there's a plan that is developed. Beginning in late February, there were a series of webinars and public meetings seeking input and comments from other interested parties. The department has begun the process to draft the RFPs for the managed long-term supports and services system with an expected release date in early fall 2014. We do not have a targeted implementation date at this time, but anticipate that it will not be prior to the middle of 2015. We believe that a move to managed care is the next logical step in our long-term supports and service transformation and is the logical step for what we're doing with our Medicaid program as it is and how managed care has improved quality and improved cost for our other populations in managed care. And we want to make sure that that is echoed in the people that, the individuals with developmental disabilities and individuals with age-related disabilities. Thank you.
Thanks, Rocky. We have time for a couple questions before I make very brief closing remarks. We also have packets with a lot of the copies of the presentation, other background material in front of Josh, and he will be at the back to hand those out to you as you're leaving. Questions for Mark or Rocky? No questions?
Over here.
Oh, I'm sorry. Go ahead.
Well, I guess, and maybe, it's difficult to get into some of this kind of stuff, but it sounds like everything's great big love fest.
Can you use the microphone just so other people can hear you? And can you just introduce yourself to the panel?
I'm Representative Watson from Tulsa. And I'm just curious in terms of, being office holders. Obviously, part of this session was politics. Politics is the crazy nutty part of what we get involved in, whether we want to or not. And it seemed like everything's kind of just, hunky-dory with you, but obviously we've got special interest involved in this, and it's a tough road. Just your thoughts in terms of if you were in our position on the front end of something like this, if you had any thoughts generally about the political side of it, that maybe if you were in our position, you might do a little differently based on what you may have learned in Georgia and Louisiana. I suspect you maybe not. You may not be through in Louisiana yet, so whatever you might share in that regard.
Sure, if I might. Sure. Okay, so everything was not rosy. Understand that we're many years into it now, and so many of those bumps have been worked out. There were the politics. I was sort of poking a little fun at the governor's observation about HMOs and CMOs, but that was a part of it, quite frankly, is, you have to be thoughtful about how you share information that you share, not to be anything but transparent, but to understand that there are some things that carry baggage and inferred information, and you have to be sure that what you're proposing to do may in fact be very different than what they might be used to, so make sure your message is clear and transparent. I would say probably one of the most important things politically, and I was not a politician and I was not the governor, obviously. I did work for the governor. But I would say that probably one of the most important things for me to get this done and get it done as successful as it has been was the resolve to get it done. In my case, I worked for the governor, and it was the resolve of the governor to get it done. We also have a very fiscally conservative legislature, and so they were very concerned and on board with this movement. However, they all work in districts and have constituents in those districts, including healthcare providers. There was angst about what will this mean, what will happen to them. There were some initial bumps, getting folks credentialed, for example, providers credentialed in a timely way. The good thing about it, though, is that we had a contractual partner that we could turn to and say, get it done. Whereas before, as a Medicaid director, if I was minus some docs in a certain area, I had 6 staff that covered the entire state to go get it done. Well, there's about 45,000 licensed providers in the state. You can see it's just an impossible task. So the other thing is that making very sure that as we were going along, both to our legislature and to our governor and to the general public and the provider communities, we worked very closely with the various associations, that as we were going through the next step, whatever it might be, we informed folks when is it happening, what's going to happen, how you need to be prepared for it. We've done some other things in response. We haven't just gone forward like a bull in a china shop. Well, we had the resolve, but not bull in the china shop. We've listened to providers that we've gone along. So, for example, credentialing. We have 3 different plans and the Medicaid. So providers start saying, well, we got to enroll now with 4 different entities to just do Medicaid. So listening? Now what they're doing, the plans still credential their providers, but we've standardized the forms for them to do that. So basically, they can fill out one form and then send it to the different places. So it made it more administratively simple for them. So things like that, you listen, you're transparent, you're clear, but you have to have resolve in order to move forward, because you will always hear from somebody who doesn't like something. And again, you have to be clear about your purpose. I remember going to a workshop once with, some of you may remember Dr. Edwards Deming, kind of the quality guru, from some of our past. And he kept saying over and over again, almost every question that folks would ask him, well, what about this and what about that? He would always say, remember your purpose. What's your purpose? If your purpose is to save money, to improve the quality, to improve access, whatever that purpose is, remember that, stay focused on that.
I'll have to agree, it's very important to have resolve. Now, our managed care programs, they weren't launched until 2012. Now, Governor Jindal took office in 2008. So that was there was a period of time where we had to deal with, there was a change in the federal administration. We had a waiver up during the George W. Bush administration that the Obama administration didn't want to go forward with, so we had to change our plans at that point. We eventually had our authority for managed care through a state plan amendment, which made things easier. We had issues with our state legislature, with what they were hearing from different providers and the fears that managed care would mean less payment, less access. The things that our managed care programs have proven are false. And so we had to get that buy-in from the different providers, the different stakeholders, and just continue to move forward. So just that people are going to say that there needs to be a study and there needs to be a pilot, but we just had to get it done because it's an issue. It's not only cost, these are people's lives. These are our most needy. These are people that rely upon us as a safety net. And so we can't go forward with the budget being broken and the loss of services through Medicaid. This has proven to increase services to our recipients and increase choice. So you just need to have that determination as you move forward to transforming your Medicaid program.